train all of our staff that whenever they're working with blood and or body fluids, that you do what you need to do to protect yourself from the spread of infection, you spreading infections to clients and clients spreading infections to you. So what are some of the tasks that you think you do on a daily basis that put you at risk of coming into contact with blood or body fluids? Any ideas?
Checking blood sugars.
Checking blood sugars, any kind of toileting, bathroom care, toileting, showering, bathing, washing hair, doing nails. Some other examples are doing treatment creams, anything where there's a possibility of you coming into contact with blood and or sputum, any kind of body fluid, urine, stool. So we have to train all of our employees that they protect themselves. So one of the most important things you can do to protect yourself from the spread of infection is to wash your hands and to wear gloves. You wash your hands and wear gloves when you go from task to task, and you wash your hands and wear gloves when you go from person to person. When I say task to task, that can involve the same person. For example, if I'm doing a face cream and a foot cream, I'm going to wash my hands, put on gloves, do the face cream, because you always move from the cleanest area of the body to the least cleanest area of the body, towards the feet. So if I'm doing a face cream, I'm going to wash my hands, put on gloves, do the face cream. As soon as I'm done with the task, I'm going to remove my gloves, wash my hands, and then go to the foot cream. Does that make sense? Okay. When you're washing your hands, you need to remember that you need to use pump soap, not bar soap, and you need to use paper towels, not cloth towels that are in people's apartments. You should wash your hands for at least 1.5 minutes using friction, doing it like this, getting in between your nails, underneath fingernails, and also your fingernails should not be really long. We don't have a policy here that states exactly how long they should be, but as you look at your hands, if you can see your nails sticking up over your fingers, then they're probably too long. And the reason for that is that you can puncture gloves, and you can also injure clients when you're cleaning and wiping them when you're helping toilet. So that's the reasoning behind it. A couple of the more serious illnesses that you can contract from blood and body fluids are hepatitis and HIV. Hepatitis, there is a vaccine for hepatitis B that we offer here at the agency. You get your first shot, 30 days later you get your second shot, and 6 months later you get your final third shot, and that should give you a lifetime immunity to hepatitis B only, not the other forms of hepatitis. Hepatitis is a disease that affects your liver. It can cause long-term liver problems, liver cancer, and then HIV is a disease that attacks your immune system. It makes your body not able to fight infection. There is treatment for it, but there's not a vaccine for it. So if you're interested in the vaccine, you can get that through Concentra, and we'll help you set that up at the end of class. For staff that have been here for a while, you're allowed to change your mind about that. So if you said you didn't want it when you started and you decide that you do want it, you can talk to your supervisor and or somebody from nursing or Norma, and we'll help set you up to get the vaccines. Some other tasks that you do where it's required that you wear gloves, wash your hands and wear gloves, are any kind of cleaning and disinfecting when you're doing laundry, because laundry is considered contaminated. All shared equipment should be disinfected, so that means shower chairs, changing tables, bathtubs, all of that. When one client uses it, before the next client goes in to use it, you need to disinfect it. Now, a couple things about disinfecting that you need to remember. Lysol is a great disinfectant, but you have to spray it on a surface and it has to sit for 10 minutes before you wash it off with hot soapy water. Otherwise, it's not effective. Bleach you can use. The solution should be 1 part bleach to 10 parts water. So if you're making a bucket of water for cleaning and you want it to be truly disinfecting, you can use a cup of bleach with 10 cups of water. I prefer things like Lysol because it doesn't damage your clothing. Bleach is a little more caustic if you get it in your eyes, if it splashes in your eyes. In ILP, you kind of have to use what people buy. They buy their own groceries, purchase their own things, so you kind of have to use whatever disinfecting agent is in the house. All sharps should go in plastic containers. You need to make sure that when you're checking people's blood sugars that you take the dirty needles out of the pens and put them into a plastic container. If you don't have a plastic container, you can use a Pepsi bottle or something that's non-permeable. It has to be plastic. Universal precautions, if you hear that term, it just means that you treat everybody as if they're potentially infectious. For example, you would never wear gloves to toilet one person and then not wear gloves to toilet someone else, because it's not about the person that you're working with. It's about the task that you're doing that determines, when you wash your hands and wear gloves. Personal protective equipment just refers to anything that you might be using to protect yourself. Gowns, gloves, masks, anything that you're using like that. In the sites, there are first aid kits that have CPR masks, gowns, gloves, all the personal protective equipment that I just mentioned. If you use the gowns or anything that's in there, or the CPR mask, please let your home manager know so that they can replenish what you took out of the first aid kit. Disposal of contaminated material. Whenever you're getting rid of things that are contaminated, there's some guidelines and rules that you need to follow. For example, anything blood contaminated that you're throwing away at this site, at Edendale, at Memphis, and at Westlake has to go in a red bag and be double bagged. So you'll see little red garbage bag containers in the bathroom at the sites I just mentioned. So again, anything blood contaminated, blood on a Band-Aid, sanitary pads, whatever, that has to go into the red bags. In people's apartments, you don't need to do that because you're in people's private homes. But there's a different set of rules that govern us in sites like here that we need to follow. So just be aware of that. That it has to be red bag, double bagged if it's got blood contaminated items on it in those sites. Cleaning schedules, you'll have to check with your supervisors about that, home managers about that. They'll be different at different sites. So just know that there are cleaning schedules that you need to adhere to. And doing laundry, at Edendale I think they have big bins that are on rollers. They're plastic lined. Am I right? Okay. In ILP, you're not going to see that. You're going to see that people have two clothes baskets, one for dark, one for white. Should be plastic so that nothing can leak through it. And then when you get ready to do the laundry, you can't sort it on the floor, because if you sort it on the floor, you've contaminated the floor. So that's why I say there's usually two baskets for everybody, whites, darks. And then you wear gloves when you load the washer. Keep the basket away from your own clothing when you're dumping it into the washer. Once the laundry is done, you don't need to wear gloves. When you're loading a dishwasher, you should wear gloves. When you're cleaning contaminated surfaces, you should wear gloves. Just a couple things about doing laundry too. When you're stripping beds that are urine soaked or whatever, if somebody's had an accident, you have to make sure that you do the laundry and that you also disinfect the mattress cover. So a lot of times I tell people that's a good time to use Lysol spray or something like that and let it sit for 10 minutes and then wipe the mattress cover off with soapy water. Also want to mention just a word about wheelchairs. People spend a good part of their day in their wheelchairs and they eat in them and everything else. So at the end of the day, make sure that you are getting people out of their wheelchairs and that you're disinfecting the chair, wiping it down, disinfecting it, and vacuuming it, making sure that you get all the crevices and everything from the chair clean. That should be done on a daily basis. Just want to talk a little bit about an exposure incident in case that happens so that you know what to do. An exposure incident is when two people's body fluids mix. So a good example is a human bite. If somebody bites me and the skin is red, that's not an exposure incident. But if somebody bites me and the skin is broken, now all the microbes that were in their mouth have now been introduced into my bloodstream. That's one example. Another example is if I check somebody's blood sugar and I stick myself with the needle after I've stuck that other person, now all the microbes in their blood have been introduced into my blood system. When that happens, it's considered an exposure incident. You need to be seen by the doctor within 24 hours. You need to have blood work done. They'll probably give you a tetanus shot if you haven't had one, and they'll give you antibiotics because it's considered a dirty wound. That being said, it is not the agency's responsibility to give you your tetanus shots every year, or every 10 years, or to pay for you to go get your tetanus shots. So please be sure that your tetanus shot is up to date. If you haven't had one in 7 to 10 years, call your doctor and tell them and go in and get a tetanus shot. So all of that blood work will be done for you and the other person involved. And then 14 weeks later, you go back and you have all that blood work repeated again, just to make sure that you're still testing negative to HIV and hepatitis, because that's what they're going to check you for. Normally you will go to Concentra for that, to have the blood work done, but you do have a choice of going to your own physician if that occurs. It's up to you. Okay, I think I pretty much covered everything. Does anybody have any questions?